Did you know that there's different types of stem cells and that there's some that are better than others? Well, stay tuned on today's video to find out the answers to those questions. Hello, this is Dr. Brandon Pettke with Lone Star Progressive Medicine. In today's video, what I'm going to be discussing is the different types of stem cells. There's basically 6 types of stem cells that can be used and that have been used in a clinical setting. And so I want to cover those 6 different types of stem cells. The number 1 stem cell that I'm going to cover is definitely one that we do not use here in the clinic. It's the one with all the controversy. It is the one that comes from embryos. It's embryonic stem cells, and those actually come from aborted fetuses. And in fact, it's illegal to use those in this country, in the United States. There are countries in Europe where people can use them. But beyond the personal ethical and moral issues I have with it, even just straight from a clinical standpoint, they do not have that great of an outcome anyway. So that's the first type, is embryonic. Again, we do not use those type of stem cells here in the clinic. The number 2 and the number 3 that I'm going to discuss, they're very similar in nature, and so I'm going to cover those kind of together. Number 2 is amniotic stem cells, and number 3 is placental stem cells. And so amniotic and placental stem cells come from the amniotic tissue and the placental tissue after a baby is born. And so what they do is they can extract the tissues from that. They can extract the stem cells from those tissues, and then they can utilize those stem cells. There's 2 big drawbacks to that. Number 1, with amniotic and placental stem cells, there is not that many stem cells when you actually look at it when you do third-party testing. There's not that many stem cells, and some have even shown that there's not any live stem cells. And that's very important because you actually need live stem cells to recreate that regeneration and that repair within the tissues. So that's a big drawback. The second big drawback is that when they actually do through amniocentesis, when they draw out the materials, there can be debris, and with that debris, it's a small chance, but there is a chance for that to create a reaction within the individual patient. And so again, we don't use amniotic or placental stem cells for those reasons. The fourth one I'm going to cover is bone marrow stem cells. So bone marrow stem cells are used in a number of clinics. What they do is they use the patient's own bone marrow, the stem cells from their bone marrow, and so they literally do a bone marrow aspirate. So it's a big needle into the hip, and they draw out that bone marrow, and then they harvest the stem cells from that bone marrow, and then they take the individual's stem cells and they inject their own stem cells back into the body. And so first, there's a surgical procedure that goes with it, so there's always a potential side effect for any type of surgical procedure. Not everybody likes being poked with a big needle on top of that. But the other thing that I would say more so than that is that there's 2 things with stem cells that you always want to have. You always want to have the youngest stem cells, and you always want to have the most lively and robust stem cells, and that goes with age. And so what happens is, as we age, we have less and less stem cells, and they are not as lively and robust. They don't double as quickly. So 1 become 2, 2 become 4, so forth and so on. So there's that drawback to that as we age, we have less stem cells, and they're not as lively and robust. And I talk about that in another video. You can check that out on our YouTube channel, and I go into specifics about that. But just know that we want to have stem cells as young and as lively as we can get them. And so most of our patients that do stem cells, not all of our patients, but I would say the majority of our patients are 50s, in their 60s, 70s, or 80s. And so they're going to have less stem cells, and they're definitely not going to be as active. So what that means to you, the patient, is that you're not going to have as big of therapeutic benefit driving down pain, having that regeneration and repair as much as you could with something that's a younger, more lively stem cell. Number 5 is similar. It's adipose stem cells. And so adipose stem cells, adipose is the technical term for fat tissue. And so what they do there is they do a liposuction and they draw out that fat tissue, which I know you're probably thinking right now, oh, okay, I'll be happy to lose some weight. But they don't really take that much adipose tissue out. It's just about the size of a stick of butter is the amount of adipose tissue that they take out. They, again, take that into lab. They harvest that there. They harvest the stem cells out of it. They take those stem cells and they inject it back into the individual. And so just like I talked with bone marrow stem cells, if the patient is in their 50s, 60s, 70s, 80s, whatever the case may be, they're going to have less stem cells available to extract out of that adipose tissue. And they're not going to replicate as quickly as they could with a younger stem cell. So I won't beat that dead horse, so to speak, but that's the same similar drawbacks as a bone marrow stem cells. And that brings us to the last one, which is the number 6 one, and that's what we use here in the clinic. We use umbilical cord stem cells, and the reason why we use umbilical cord stem cells is because they are the youngest that you can get, and they are the most lively. There's no surgical procedures, which means there's also no potential downtime of anything like that. And so that's what we use. So these stem cells come from live, healthy, full-term births, healthy mom, all of that. In many cases, the umbilical cord and the placenta are going to be thrown out. And so these mothers elect to donate those umbilical cords. And so they go through a series of testing, and they test for about 17 different communicable diseases, just like if somebody was going to go donate blood or plasma or something like that. Same exact type procedures, and if all checks out well, then what they do is they harvest the stem cells from that umbilical cord. And so then they take that stem cells, they freeze those in the lab at negative 260 degrees, and they keep that in the lab until a clinic like ours orders it. And so then when we order it, they overnight it to us on dry ice, and we inject it that next day into the patient for whatever issue that they're having. Those are the overview of the 6 main types of stem cells. Hopefully this information was useful for you. You can learn more about in another video the doubling time and the amount of stem cells with age, so you can check those out on our YouTube channel. But anyway, I hope this information was useful. If you have any questions, as always, you can leave comments down below and questions down below, and we'll get back to you and answer those. If you're interested in stem cells for yourself, then you're more than welcome to contact the clinic and set up an appointment where you can come in and see if you're a candidate for stem cells as well. But I hope you have a wonderful day. Take care.